Hi, welcome to my YouTube channel. Today I'm going to be talking about interviews. It's all about preparing you so you can have that healthcare assistant role that you wanted. If you are interested and you are enjoying the content I'm sharing with you, please press the subscribe button. Make sure you press the bell so that you get notifications when I've done more videos. So what's upcoming in my videos, I'm going to do a video on CVs so that you can have an excellent CV that's going to get you to be picked over other people. If you're interested for that, stay tuned. My video will be uploaded soon, so keep an eye out for that. Let's go back to interviews. I'm pretty sure that because of the circumstances, you might be invited for a Zoom interview. So these interviews usually last between 30 to 45 minutes. I'm just going to share some tips around Zoom meetings. So I'm encouraging you to make sure you find a place that has good lighting, that is quiet, that allows you to sit comfortably and record yourself, or hold a PC and make sure that you're coming out correctly. Think about the posture you're going to take, and practice this. Take a video of yourself, practice, see how you look in those videos, and practice as much as you can until you find that perfect area, the perfect spot to sit for your interview. That's my number one tip for you, because if this is not done right, you will not come across professional enough. You will not come across the right way. Make sure you've got enough data that lasts you between 30 to 45 minutes. I know interviews are quite scary, and that's part of us being human, but I would encourage you to practice as much as you can. I'm going to share tips with you that I believe are going to help you, so that when you hear a question from an interviewer, you know exactly what they're asking of you and you'll be able to answer it with confidence. Right, I want to share with you the STAR technique. This technique is really useful in shaping how you answer your question. So what does STAR represent? It represents situation, task, action, and results. So I'm going to start with S. S is for situation. So I want you to think when you're asked a question. So this works really well with scenario questions. So it might be that you're asked, can you tell me a time when you've done something really well? Or tell me a time when you've worked in a team and you were pleased with the work that you've done. So your response would be, give a situation. I used to work for this company, and we had this big problem. Give a situation of what was happening in that environment. Who was there? Who were you working for? And say what your task was, what was your action, what were you meant to do. Just shape your answer to give situation, task, action, and the results, so that you're ticking all the boxes, so that your interviewer doesn't have any questions after you've given your answer. So one of the questions that usually come up is, tell me about yourself. So this is more like an icebreaker question. It's a question that's trying to get to know you. So I would say this is your opportunity to impress the interviewer or the employer. So my advice to you is, when you hear this question, I want you to think of three things. The first thing is, tell this person about yourself. Tell the employer about yourself. I'm a mom. I do this for a living. I enjoy shopping. I'm currently working for this company. So talk about your work history. I want you to talk about your work history that leads you to applying for this job. So I want you to be tactical about it. I want you to talk about the work that you've done previously. Talk about it briefly. Talk about the work that you've done briefly, and talk about the experiences that you've had that match the skills in the job description. And this is going to land you, this is going to help you to answer this question. So there's a similar question, tell me about yourself, is quite similar to why do you want to work, why do you want to be a healthcare assistant. So again, same thing. Think about 3 things. Talk about yourself, the things that you enjoy. You're a person of a caring nature. You love looking after people. You've looked after your neighbor. You've looked after your family. You've looked after a baby. Think about those scenarios and say, because I enjoy doing this, that's why I want to be a healthcare assistant. I want you to talk about why you want to be a healthcare assistant specifically for that company. So do your research, look at their values. What do they value as a company? I want you to say, I want to work for this company because you value your patients, you value patients' care. And mention those things that are on their website and say, I also share the same values and I want to be part of a company that's changing lives, that's making a difference. Refer to the job description. You need to have looked at the job description and know the job description in and out. Look at the skills they're looking for. Think about transferable skills that you have. Perhaps you haven't done healthcare assistant roles, but think about transferable skills that you have from your previous job. So I'm going to move on to the next question. What skills are important for a healthcare assistant? They're going to ask you that. What do you think is important for what skills should a healthcare assistant have? So I would say, again, the answers I'm providing for you, they're quite vague. And they're also transferable if you haven't got specific experience in healthcare assistant. So I would say communication skills. It's important for a healthcare assistant to be able to communicate with patients, with family, with doctors, with nurses, just having that ability to communicate effectively. That's a skill that a healthcare assistant needs to have. I would say listening and observation skills. These are really important because if something is not quite right, you're able to notify the right people. You're able to identify a change in patients. You're able to identify when something is not right and you notify the right people. So listening and observation skills are quite key for a healthcare assistant. I would say time management. A healthcare assistant needs to have excellent time management, the ability to prioritize work and work in a timely manner so that at the end of the day, you're not rushing to finish your work because it's time to go home. So I would say those 3 are top qualities. Again, I would put in something like caring. I'm of a caring a healthcare assistant should be of a caring nature because the job really is about caring people. You've got to be passionate about people. You've got to be passionate about looking after people. Right. The next one that you might be asked is, what is your strength? I would again refer to the STAR situation the STAR technique that I've shared with you. I would think about something that you've done really well, and I would want you to, pick a strength that you have, and I want you to talk about that strength and give an example about that strength. And I also want you to think about how you can back it up. So for instance, we could say team working. So maybe give an example of when you performed really well. Again, give that situation. What was your task? What was your action? What action did you take? And what was the result? And what feedback did you get for that particular job, for that particular strength? So I would phrase it as probably teamwork. I have excellent teamwork skills, and give that situation and just make yourself shine. This is the time to make yourself shine. And don't forget to say what feedback. It might be feedback from patients, it might be feedback from managers, it might be feedback from colleagues, or it might be that you did something really well, you implemented a skill that is being used currently. And those are the sort of answers that interviews are looking for. So you always have to be prepared. When you're asked about your strength, the next question that will come is about your weakness. What is your weakness? So I want you to be honest about your weakness. I want you to talk about it, because turning around and saying, I do not have any weakness, it's not a good idea, because everybody has weaknesses. But I want you to talk about a weakness that is not going to jeopardize your job. So do not say, I hate elderly people, or I hate vulnerable people, or I don't enjoy caring for people. I want you to think about something that is possibly outside the job description, because I remember we're looking at the job description and things that are required of a healthcare assistant. So I would say something like, my weakness is public speaking. I don't enjoy speaking in public. That's a really, really good one. You will be asked for scenario-based questions. So scenario-based questions are more like, can you tell me of a time when this happened in the past? Can you tell me of a time when this happened? So scenario questions are really directed at you, at your thinking process. They want to know, if this situation happens, how is Lisa going to respond? How is what are the steps that this person going to take? So it's all about thinking process. Again, can you tell me, what would you do if you found a member of staff being cruel to a patient? So this is more about thinking process, your thinking process. How would you deal with it? What do you know about safeguarding? Are you the right person for this job? Can you safeguard our patients? Because you are part of that safeguarding. So that's what they're trying to get from you. So my advice to you is, make sure you read the policies, safeguarding policies, confidentiality policies, all the policies that you can read about it, so that you understand what the correct action to be. So I would say something along the lines that I would adhere to all the safeguarding policies. I would not let that situation go unseen. I would tell you, if this ever happens, I would follow the procedures, the company procedures for dealing with such situations. So those are the things that the employer is looking at. It's how you handle it. Are you going to, fight with a colleague? Are you going to cause a scene? How are you going to deal with these situations? Because these are real life examples, real life situations that actually happen. They might ask you, a family member rings you to ask for blood results for a patient. How would you respond to this family member? So what they're asking, or what they're trying to understand, is, do you understand the confidentiality policy? Do you know that you can't just give people information without consent? Are you the right person to be passing those results? Does this person have the right to know about these blood results? So it's all about procedure, confidentiality, procedure within that company. So it's important that you say, I will follow the confidentiality policy. I would check that I'm the right person, and I would check the process, when and who and when are these results meant to be given, and when are they meant to be shared, who's the right person to be. I'll check in the policy that who's the right person to be sharing this. So do not say, I wouldn't share this information. You've got to show your thinking process, that you're aware of the confidentiality process. You're aware that, there has to be a process where the patient has given consent for that family member to be told about, their health and their care. So that's another example that you can prepare for. Another one is, how would you respond if there was an aggressive patient? What they're looking for is, again, your thought process. How would you respond to this? Are you going to fight with this patient? Are you going to raise your voice? You're not going to raise your voice. Your answer is going to be, I will follow the procedures, the policies and procedures that we have for dealing with this situation. You talk about, my priority is the safety of the patient, my colleagues, and everybody else around there. I would do a risk assessment and make sure that everybody is safe. If I do a risk assessment and find that this situation I cannot handle on my own, I would, requests for support. It's all about thinking outside the box and remaining calm and not aggravating that patient, or not fighting that patient, or raising your voice, or making the situation worse. They're looking for people who can make situations a lot easier and a lot calmer. So you need to be a lot calm, and you need to be respectful and deal with the situation in a calm manner. Right. The last one is, it could be, can you describe a time when you had a conflict with a employee, with a colleague? I would say, if you did have one, do tell what happened. But my advice to you is, possibly think of an example of when you did something positive, when you were not in the wrong and you were in the right. So possibly say, a colleague was breaking protocol. How did you deal with that? It might be that you might say, we had a conflict because I decided to call the colleague privately and told them that what they were doing was not right. The colleague wasn't happy because we're on the same level to receive instructions from me. As a result, we had a conflict. So something where you did something positive and you are not necessarily in the wrong. So that's my advice to you. I wish you all the best. I would encourage you to subscribe to my channel if you found this information interesting. My upcoming videos are going to be around CV. I'm going to do one on culture to prepare you for the English culture, so that you can know what the English culture is like. I'm also going to do one about different places that you could work as a healthcare assistant, so that when you're looking for work, you know what you're going for. If you found this interesting, please subscribe to my channel for more content. Thank you very much for watching.